Imagine this. You sit across from a therapist, hands folded in your lap, voice trembling as you confess your deepest fears. The room is soft-lit, sterile in its comfort, designed to make you feel safe. The therapist nods, their expression a practiced blend of empathy and neutrality. They ask the right questions, offer the right pauses, everything by the book. And yet, as you leave the session, something gnaws at you. A quiet, unspoken dread. Did you just pay someone to pretend to care? Therapy is hailed as the sanctuary of healing, the modern answer to the soul's cry for help. But beneath its polished surface lies a paradox. What if the very system meant to mend your mind is also shaping it into something acceptable? Something that fits neatly into the grooves of society's expectations? What if therapy, in its quest to fix you, is quietly sanding down the jagged edges that make you you? Consider the unspoken rules. You are encouraged to express your pain, but only in ways deemed productive. You are taught coping mechanisms, but never to question whether the world you're coping with is the real sickness. You are guided towards self-acceptance, so long as that self doesn't disrupt, rebel, or demand radical change. Is healing supposed to feel like surrender? The great, unsettling question lingers. What happens when therapy becomes less about liberation and more about adjustment? When the goal shifts from true self-discovery to mere functionality? The answer is hidden in plain sight, buried under layers of well-meaning intentions and unexamined assumptions. And the deeper you dig, the more terrifying and exhilarating the truth becomes. This is the dark side of therapy no one talks about. But why does it exist? And what does it want from you? Therapy, at its core, is a mirror, one that reflects not just the individual, but the unspoken values of the culture that shaped it. And here lies the problem. Therapy does not exist in a vacuum. It operates within a system that prizes productivity, stability, and conformity above all else. The moment you step into a therapist's office, you are entering a space that has already decided on some level what healthy looks like. But who defines healthy? Carl Jung warned of this danger when he wrote, "The shoe that fits one person pinches another. There's no universal recipe for living." Yet modern therapy often leans on standardized models, cognitive behavioral tweaks, symptom reduction, behavioral adjustments, as if human suffering can be neatly cataloged and corrected. Friedrich Nietzsche saw this coming long before the rise of psychotherapy. "They all want to help," he wrote, "but their help is like the executioner's kindness. They cut off the head so it no longer aches." Therapy, in its institutionalized form, risks becoming a tool of what philosopher Michel Foucault called biopower, the subtle control of bodies and minds under the guise of care. It pathologizes dissent, medicates despair, and labels intense emotions as disorders rather than signals of a deeper existential truth. Viktor Frankl, who survived the Holocaust and founded logotherapy, understood this intimately. What man actually needs is not a tensionless state, but rather the striving and struggling for a worthwhile goal. Yet modern therapy often seeks to remove tension rather than help you find meaning within it. And then there's the most insidious assumption of all, that the problem is always inside you. Never the world, never the system, never the soul-crushing weight of late-stage capitalism, the alienation of modern life, the absurdity of existence. Jean-Paul Sartre called this bad faith, the lie we tell ourselves to avoid facing uncomfortable truths. So ask yourself, is therapy healing you, or is it teaching you to better endure a cage you've stopped noticing? The answer is buried in the shadows of our collective psyche. And the consequences of ignoring it are far darker than we dare admit. The most dangerous illusions are the ones we mistake for reality. And the illusion therapy often sells, whether intentionally or not, is that personal adjustment equals liberation. But what happens when millions of people are quietly taught to pathologize their own unrest? The consequences ripple outward, invisible but undeniable. Consider the medicalization of normal human suffering, the way grief becomes complicated grief disorder, intense passion becomes hyper-emotionality, and existential questioning gets dismissed as rumination. Neurologically, we know the brain adapts to whatever framework it's given. If you're repeatedly told your sadness is a chemical imbalance rather than a legitimate response to life, your mind begins to interpret it that way. The placebo effect works in reverse, too. Diagnoses become self-fulfilling prophecies. Then there's the commodification of healing. Therapy is now a multi-billion-dollar industry intertwined with pharmaceuticals, self-help empires, and workplace wellness programs, all promising happiness as a purchasable product. Aldous Huxley foresaw this in Brave New World, where citizens were pacified by feel-good drugs and conditioned to believe their suffering was irrational. But I don't want comfort, protests the savage. I want God, I want poetry, I want real danger, I want freedom. Worst of all is the erosion of autonomy. When people are taught to outsource their emotional authority to experts, they lose trust in their own instincts. Studies on therapeutic outcomes reveal a startling truth. The most significant factor in successful therapy isn't the method used, it's the client's belief in their own capacity to heal. Yet the system rarely encourages this. Instead, it fosters dependency, subtly implying you're too broken to navigate your own mind without professional guidance. The darkest consequence? The silencing of revolution. History's greatest changemakers, artists, philosophers, activists, were often the unwell by today's standards. Van Gogh's torment birthed Starry Nights. Nietzsche's despair forged existential courage. What if therapy, in its quest to soothe, is also sterilizing the very discontent that fuels transformation? This isn't conspiracy, it's cultural conditioning, and it's working exactly as designed. But there is a way out, a rebellion waiting to be claimed. The moment you realize therapy is a system, not an absolute truth, is the moment true healing begins. Because systems can be questioned. They can be hacked. They can be outgrown. The first act of rebellion? Reclaiming your right to define your own suffering. Viktor Frankl wrote that between stimulus and response, there is a space. In that space is our power to choose our response. Therapy often collapses that space, offering prepackaged explanations for your pain. But what if your depression isn't a malfunction, but a brutal clarity? What if your anxiety isn't a disorder, but the tremors of a soul realizing the world is not as it should be? History's most radical healers understood this. R.D. Laing, the renegade psychiatrist, argued that madness could be a sane response to an insane world. Carl Jung warned against therapeutic fascism, the tyranny of forcing people into prefabricated boxes of normality. The solution isn't to abandon therapy, but to weaponize it, to use its tools without surrendering to its dogma. The counter-curse. 1. Become a Socratic patient. Question every diagnosis, every framework. Ask, who benefits from me seeing myself this way? Demand therapists who say, I don't know more than you should. 2. Seek liminal guides. Find mentors outside the system, poets, philosophers, wilderness guides, elders. As Nietzsche wrote, one must still have chaos in oneself to give birth to a dancing star. 3. Practice existential triage. Distinguish between pain that needs fixing and pain that needs witnessing. Some wounds aren't meant to heal cleanly, they're initiations. 4. Reject the cult of happiness. Schopenhauer was right, life is suffering. But in that truth lies unexpected freedom, the relief of no longer chasing a fantasy of perfect adjustment. The rebellion isn't against therapy. It's against the lie that you are the problem. It begins when you stop asking, what's wrong with me, and start demanding, what happened to me and who gets to define the ending? The final truth, the one that changes everything, is closer than you think. Here's the secret no therapist's office will give you. True healing begins when you stop trying to be healed. Not because you're broken, but because the quest for fixing yourself is the very cage keeping you trapped. The ultimate paradox? Wholeness was never something you lost. It's something you were convinced to seek. Every great wisdom tradition whispers this truth in different tongues. The Buddhists call it tathata, suchness, the perfection of things as they are. The alchemists sought the philosopher's stone only to discover it was the seeker all along. Jung's individuation reveals the self was never divided, just waiting beneath the noise of shoulds and supposed tos. Therapy's dark side isn't malice, it's forgetting. Forgetting that pain isn't always pathology. That sometimes the most disordered among us are the canaries in civilization's coal mine. That the ache you carry might not be a flaw, but a compass. When Kafka wrote, "A book must be the axe for the frozen sea within us," he named what real transformation demands, not adjustment, but shattering. Not coping, but awakening. So here's your axe. 1. Your worst symptoms are often your truest language. The body keeps score because the soul refuses to lie. 2. Therapy is a map, not the territory. Use it when needed, burn it when it tries to tell you your fire is a malfunction. 3. Healing and power are the same thing. Not power over, but power with. The kind that lets you stand in your storm and say, "This too is mine." The final truth? You were never sick. You were alive in a world that profits from convincing you otherwise. Now, what will you do with that?